Hi everyone, welcome back to my YouTube channel, Global Nurse Stories. Thanks for the support so far. Thanks for the like. Thanks for subscribing. And I hope the previous videos have impacted someone out there. Don't forget to share. Don't forget to like. Don't forget to subscribe. And hit the notification button to remind you to whenever there's a new update. So today I have a friend in the house, a friend that America gave to me. Um, we've known each other for the past 5 years, and she's a colleague. She's so resourceful. She has helped me in along the way, especially when I'm about to get my BSN in nursing here in the United States. A thoughtful advice that time actually helped me. I hope to share that story one day. So today I have Martha in the house. So I will leave Martha to introduce herself. Martha, will you please tell us who you are, where you're from, and a little background of your nursing career? Thank you. And
All
before you
right.
go to that, can I just say thank you for honoring my invitation? I know in America everybody is busy, but despite a tight schedule, you still find the time to come to this channel. I really appreciate that. I didn't take it for granted. Thank you.
All
Over to
right.
you.
All right. Thank you so much for having me here. Thank you so much for the invitation. I just want to say I appreciate it. Yeah. So my name is Martha Mwaba. I'm originally from Zambia, and I've been a nurse really since 2007. I graduated 2007. I was trained in Lusaka, Zambia. I was at University Teaching Hospital. Yeah, that's where I got my training from. So we relocated to the United States in 2018 October, and we've been here since. We got our citizenship. It's really
Wow.
been yeah, a great transition. Yeah, so like I mentioned earlier, I've been in a 17 years. I pretty much worked in outpatient, pediatrics, med surg, telemetry. Currently working here at WorkMed in North Carolina. I'm on a step down unit right now. Yeah, so really I've just been doing nursing pretty much my entire adult life, and I think I not really, I think I do appreciate the career, and it's really opened up really great doors for me. Yeah, so thank you so much for having me.
Wow. Thank you for
Mm-hmm.
that background introduction.
Mm-hmm.
Yeah, so Martha, I could see your credentials there. You have MHA, BSN, RN, and when you are doing your introduction, you said you started your nursing education in Zambia. So I just want to know all these credentials behind your name. Did you get it from Zambia or after transitioning to the United States?
Yeah, so back home, I trained as a registered nurse. I had a diploma in registered nursing. The time I started this entire process, really, I just had the diploma in registered nursing. OGP employed me as a diploma nurse, and I came in with my diploma. Yeah, so coming here, when I was doing my contract, it was a 2-year contract and some change. I decided that at least by the time I'll be done with the contract, I wanted to really have more, opportunities, more doors opening up. So I decided to go ahead and start my BSN. Yeah. So as an internationally trained nurse, of course, you have to look at schools that are going to take you in and schools that are going to look at your transcript. Yeah. So that's how I started, researching and looking into schools available, and I came across Grand Canyon University. They
Wow.
have, yeah, they have their own, evaluation body. So it was really easy. I didn't have to pay anything. So all I had to do is pretty much just submit my transcript. They looked at it and said, okay, fine, you can, start your BSN. It was during the COVID time. That was 2020. So it was pretty much easy and straightforward. It was all online, just papers, APS style papers, and within a year I was done with my BSN, and it was pretty
Wow.
much straightforward. Yeah, it was easy. I think that
So
was the
no,
easiest school I've ever done. School is not
so
easy back home.
that would take me to the next question. If you were to
Mm-hmm.
be in Zambia, will
Mm-hmm.
BSN take you just a year and will it be
No,
online?
at all. So back home, transitioning from a diploma nurse to, a bachelor's degree nurse, it takes you at least 3 years. Because yes, you'll be doing what they call distance education, and you have, you should be, they actually go in for like residential while you go into school full time, like I think for 2 weeks or something, come back, since people work while doing that. So at least a minimum of 3 years for you to complete if you're transitioning. So you can imagine I cut that off. Of course, probably I had to pay more, a little bit more here, but we have student loans, so actually that helped out a lot.
That would
Yeah.
have been the next
Hmm.
question.
Okay.
Yeah. For your BSN, I know you've
Mm-hmm.
had BSN, you have masters. So for your
Mm-hmm.
BSN, how easy was it to get a student loan? And does it have interest? Like, how is the interest calculated? How easy was it? Did you get some grants? Just how were you
Okay.
able to get that BSN, or did you pay out of pocket?
All right. So the entire cost of the BSN program was like $15,000. Of course, I couldn't pay that out of pocket. So the school actually guides you through, with everything financially. Yeah. So I had what they call a counselor, a financial counselor that actually guided me through. I just had to submit, my papers and my pay stubs, whatever, and whatever it is that I needed. I submitted that. They looked at it and were able to, grant me. I applied for the FAFSA. The school guided me with that, and that's how, I started the entire process. I was given what they call a Pell Grant. It wasn't really much, but at least it cut off some of the money that I had to pay. So that also helped. I think they gave me about $6,000. So that also helped me, cut off some of that amount of money. But the entire BSN took about, like I mentioned, about 12 months. Yeah. And you could actually do more than one class at a time. It's just that I was doing one class at a time. So it was really, I kind of dragged, but I did one class at a time, but it still took me 12 months. It was pretty much doable, I would say.
Wow. So even the whole money, you didn't have to pay the whole money because you were able to get some grants.
Of course, of
Yeah.
course. I got some
So how is
grants.
the interest rate on the loan? Then how much do you have left to pay? Do you have to pay as you are studying, or they give you some time before you start payments?
Yeah, so you don't have to pay right there and then. Actually, when I finished my BSN in June 2020, they'll give you an extra 6 months before they actually start deducting money from you. Interest rate it's currently at 5%. I still have some money that I'm paying off right now because I've been paying pretty much the bare minimum. Yeah, because if I was serious, I would have finished paying, but I've just been paying, just the bare minimum. The interest rate is at 5% for the loan that I got. Yeah, I wouldn't really say that it's bad, but I think it's doable.
Yeah. So yeah, so that's going to inform people how they like. But then you started using your degree to work.
Of
Does
course,
the
and
degree
it's
have
yes.
value to you at
It's
work?
Yeah, in as much as people say that it doesn't really do much, but it just opens up certain doors. So just certain things that you as a bachelor's degree nurse can do that, my diploma couldn't, even though it's just a little more dollars added, but it still makes a difference. For me, I just wanted more opportunities. And believe it or not, furthering your education just opens up certain doors that other things cannot. Yeah, so that's the reason why I decided to go ahead and get my BSN.
Even apart from opening up opportunity, there is this kind of confidence you have.
Yes,
Like,
yes,
and when you go to school, it adds value to you, it builds your capacity.
of course,
So
yeah.
even you are a better person. Like, the, I also did my BSN here, so they taught us a
Mm-hmm.
lot of things about managerial role,
Mm,
like leadership,
mm,
communication,
mm.
then like public speaking, like a lot of things that
Of
when
course,
I
yeah.
was home, everything is just nothing, nothing, nothing. I didn't really do other
Yes.
courses like that. But when I got there, it got to a point that I had a class that I
Mm,
have to watch a movie, then I have to analyze the movie. That's the
mm-hmm.
kind of
Mm-hmm.
level of
Mm-hmm.
mental capacity
Mm-hmm.
that they want you to put in when you are doing something. Like naturally in nursing school, they won't do that. You do anatomy, you do physiology.
Exactly.
So I'm also an advocate of someone going for higher degree,
Mm-hmm.
because apart from just that you have to do exams, but while you are studying,
You
you feel
you're
good, you
learning.
like yourself, you'll be
Mm-hmm.
like, oh,
Mm-hmm.
so this information are there and now you have it, then you can
Yeah.
be able to pass it on even to your
Of
subordinates and all that. It
course.
helps you to be a better
Mm-hmm.
person at work.
Mm.
Yeah. So after your BSN, then why masters in health administration? Why not master of science in nursing?
All right. So, like I mentioned earlier, I've been bedside nurse for forever. And at this point in my life, I think I've just I think I've done my time. I've served, I've done what I can. So I decided to do my master's in healthcare administration just to like move away from bedside nursing and try and find a more administrative work. I've always, loved having like an office or something, and that's what I'm looking forward to have right now. I think I've done my time doing bedside nursing, and I just wanted something different other
Okay.
than, just having to talk to patients. I would have done the FNP, I would have done these other things, but I'm just looking at something just different, something that would actually be more challenging for me. So that's the reason why I went ahead and did the master's in healthcare administration. Right now, even though I'm not using it, I think it will still be able to open up those doors that I want, God to help me open. Yeah, so that's the reason why I ventured in that. I just wanted something that was going to help me move away from having to deal with, direct patient care.
So that will take me to saying preparation is the mother of manifestation.
Uh-huh, you're right
So you are
about that.
preparing ahead. So if you can
Yes.
see it, then you will definitely
Mm,
get there. Yeah.
yes, you're right
That's a
about
good
that.
one, and that's a motivation for me too.
Mm-hmm.
So that's to tell the audience that it doesn't have to be nothing, 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 nothing.
Mm,
That's
mm,
one of the opportunities that United States of America offers nurses. Yeah. Very soon I'm going to bring a friend that is a nurse informatics. Can you imagine? Nurse in
mm-hmm.
IT? Yeah.
Mm-hmm.
Very
Mm-hmm.
soon she's going to come on board because I've been trying to reach her. So you can spread your wings
Of
as
course.
much as you want to. You don't have to be boxed into one corner doing that bedside. And that's the story of Martha. And I know
Mm-hmm.
very soon she's going to get that job.
Mm-hmm.
And
Mm-hmm.
that will actually reinforce our belief that it's
Mm-hmm.
possible because we have people do it.
Mm-hmm. Mm-hmm.
So we can also do it. And being an immigrant nurse is not an excuse for you not to explore
Mm.
the opportunity that is in the land. All right,
Yeah.
thank you. So for your
Mm-hmm.
masters, so do you have to pay out of pocket? And how was it like? Do they have to evaluate your credentials from Zambia, or they just use your BSN? Just give a brief rundown of how getting admission to get your master's went, and do they have to go back to Zambia to check your credentials, or is just your BSN they used? And since you have your BSN loan already, were you able to get another loan, or were they harder to get? I just want to
Mm-hmm.
have a view of how everything went.
All right. So since I got my bachelor's here in the United States, this was pretty much easy because that's all they needed for the master's program. So I actually used Capella University. Capella is I used the self I didn't use the guided
Phase.
path. Yeah, I used the self-paced one. So that's the one, the flex path. That's the one that I used. So it was cheaper for me. I think the entire program was less than $3,000. So they actually give you like a payment plan. You can actually be paying. They were cutting off the money like bi-weekly. Yeah, so you can actually take as many courses as you can in one billing cycle, which is like 12 weeks. But depending on how sometimes you just can't manage to just finish in one billing cycle. Sometimes you need more time. Yeah, so they actually charge you per billing cycle. So for this entire program, it was less than 3,000. Yeah, about 2,007 or $2,800. Yeah, so I did manage because I didn't want to pay more. So I managed to finish the entire program in one billing cycle. So that's the reason why I chose it. And it was pretty much affordable at the same time. So it's a lot of work, it's a lot of papers, but it's something that you can actually do. I managed to work, I managed to, manage my home and, finish the school in one billing cycle. So I would say it's pretty much doable. So I'm still, like I told you, I'm still servicing the other loan. So that's the reason why I didn't really want to add on to that. So that's the reason why I went this other path. Yeah. So pretty much out of pocket, I'll say.
Wow.
Mm-hmm.
Yeah, that's reasonable. It's not
Mm-hmm.
too much. Like,
Mm-hmm.
yeah. So then you have the credentials already behind
Of
your name.
course.
You see it
Yes.
like
Yes. So and it's
MHA,
you
BSN,
mm-hmm.
RN. Yeah. So looking at the whole journey from Zambia to US, having to go to school, work, and everything, like any challenge that you want to share with my audience,
Of
like
course, of course. Just like, childcare here is a problem. And right from the beginning, when I met you guys, I'm sure you saw how we were struggling with childcare right from the beginning. You guys came in and helped out where you could. So there's that. So having to work, having kids and having small kids in the household, and then having to do school, it's a whole lot. Yeah. So in as much as school is hard, you still have to find time for your family. So some of the challenges I would say is just finding time to balance everything up, balance time at work, because work was also a lot. And then having also finding a balance, having time with the children at home, having time for your husband, having time to just balance off everything. So it was a little bit of a challenge when it came to that. But I would say that this move overall was a good move financially, and it has actually helped us a whole lot. So I have no regrets. In as much as we've had challenges here and there, I'll say I have no regrets. Of course, the culture shock when we just got here, just having to adapt to a new hospital. Those are some of the challenges that I had to face when I came, new equipment, just new everything. And people were having trouble to understand me because of my accent. It was just a whole lot when I started working. I think those are some of the challenges that I actually faced. So just having to adapt in the beginning was a little bit, I needed time, and I lost a lot of weight when I was working at Cape Fear. It's just trying to navigate everything, trying to balance everything. It was a whole lot. Yeah, but I would say, was it worth it? I would say yes. Would I do it again? I think I would do it again because I have no regrets looking back. Yeah. Mm-hmm.
Wow, wow, wow,
Mm-hmm.
wow. Sorry, just last question. I won't delve
Mm-hmm.
too much into it. Like back
Mm-hmm.
home, I know husband and wife were working, and now the family is moving to the United States just because you got a better opportunity.
Yes.
And your husband, your spouse decided to follow you, and the kids, they have to
Mm.
leave their job, follow you. So with those few months before your spouse could get a job or find his feet here in the United States, how were you guys coping financially? Knowing that you came through agency, was the money enough? Were you able to cope, or do they have to be sending money to you from Africa, or do you have to get loan, or was the money enough? Like, because now we have different ways of coming to the United States, agency, direct hire, this, that, and that's one of the main reason that people decide to follow one and not the other, thinking I'll get more money because my husband is not working, like that, like that. And I know you also have idea about direct hire and agency.
Mm-hmm. Mm-hmm.
So can you just let us know, was it okay? Do you have to borrow money? Like, yeah,
Okay.
just an idea.
Yeah, so coming in, I came in with agency, I came in with Greater Payton. Of course, the money is pretty much new grad level pay that I got when I came in. Of course, we are paid hourly. Was it enough? I would say it was enough to pay our bills and put food on the table because we are not really struggling. I would not say that we were struggling, no. Yeah, but of course, I had to pick up extra shifts because it was just one income. And coming here, you know how we have so many bills to pay. You have insurance this, insurance that, insurance this. There's just a lot of bills that you have to pay. So of course, the first few months before we could figure out life, I just had to pick up extra shifts just to balance. But of course, even with that, we still managed to, vacation. We still managed to eat. We still managed to do what. At no point did we ever get a loan. At no point did we ever receive any help from back home. So it was pretty much the same money that OGP paid that actually just helped sustain us. Yeah. So I would say that it was pretty much, in as much it was on the low side, it was still, sustainable. It wasn't much, but it was still sustainable. We managed what we could, and we pretty much lived within our means as well. Sometimes you cannot, have everything. Yeah. So we lived within our means. If we needed more money, just pick up extra shifts. That's it. That's what we did.
I like that. That's the idea
Mm-hmm.
for nothing in America. You
Mm-hmm.
want an Apple Watch? Just
Go
one
pick up
shift.
extra shifts. Yeah.
So when the
Mhm.
shifts available, or you have to
No,
struggle to get shifts.
For the most part, Cape Fear has had a crisis from the time immemorial. So, and the time that we're coming in, that was 2018, right into COVID time, plenty of shifts. The shifts were always, always, always available. So there's always an opportunity to pick up. You can actually work 7 days if you want. There was always availability. Yeah. So, and you can always find a PRN job if there are no shifts while you're working. You can always find a PRN job. There's always needs for nurses here. So that's the good part. Yeah, there's always a need, so you can never go wrong. Yeah.
Thank you, thank you.
Mm-hmm.
You've opened up a lot of
Mm-hmm.
conversation here, and I know a lot of people would have been having that kind of thought, this, that,
Mm-hmm.
that. You've been able to provide answers, and thank you
Mm-hmm.
for being truthful. Thank you for being open to sharing your
Mm-hmm.
experience. Not everybody will want to do that, knowing that this is going out there. I
Mm-hmm.
appreciate it. So, do you have any one word of advice? Because this channel is actually set up to share our experiences so
Mm-hmm.
that people that are trying to make this move, a lot of things on the internet, like people will say you can ask Google. Yes, you can ask Google, but when you hear from
Mm-hmm.
people that have
Mm-hmm.
passed through that route, you'll be able to know that yes, it's real, it's from actual person, it's not
Mm-hmm.
just one engine AI right there, you understand, but it's real, it's someone has
Yeah.
handled it, someone has
Mm-hmm.
passed through the same route, and you are
Mm-hmm.
hearing from the source.
Mm-hmm.
So is there any word of encouragement that you have for somebody that have this plan of migrating to Western world, whether Australia, Canada, United Kingdom, United States, and they were still contemplating that, does it really worth it? As a nurse, I'm talking of someone that has been a nurse, or someone that is aspiring to be a nurse back in Africa. Now you're from Zambia, I'm from
Mm-hmm.
Nigeria. So
Mm-hmm.
this YouTube channel is not just tailored towards just one African country, all
Mm-hmm.
African countries as a whole. Do
Mm-hmm.
you have a word of advice for such people in valley of decision?
Of
Does it really
course.
worth it? Do
Mm-hmm.
I have to put in all my life savings just because I want to move my country out of Africa? Any word of
Yeah.
advice?
So of course you're gonna find so many negative things about relocating here, relocating that. But I would actually tell you to just take the leap of faith and just start the process. And I always tell people that home is home. You come here, you give it a try. If it fails, you can always go back where you came from. Yeah. So take the leap of faith and just come and start the process. Start the process and then come and join us. You can imagine, because when I was back home, I was making $400 a month, and this was a private hospital. When I say private hospital, it means that it was at least well paying at the time. Okay. But I can make my annual pay from back home in a month here. In as much as I'm just converting the dollar, it's still something that is worth actually doing. So financially, I would say it's a great move. Come and do it. And then also the children, opportunities for kids. There's just so much that kids can do here, school wise. If they're talented, if they've got skills, there's just so much that they can do here. It just opens up so many doors. It's stuff that they can't do back home. There's just so much that they can do here. So it opens up a lot of opportunities for children as well if you have children. So would I say that it was a great move? I'll say yes. And if you are thinking about it, just come and give it a try. Home is home, and information is power. Really, there's just so much information here online. You have resources like yourself right now. You're giving out information. People are sharing experiences, and if they have questions, they can always reach out and ask. You get my point? So I
Yeah.
would say take the leap of faith and give it a try. Home is home. If it fails, you can always get on that flight and go back. Yeah, so it is worth the move, actually.
Yeah, I love that. Yeah,
Mm-hmm.
nobody will ask you not to come back to Zambia now. That's your
Exactly.
country. So if you
Mm-hmm.
try and you feel, oh, I want to go
This
back
is
home.
not it. Mm-hmm.
And even to be realistic, most people that took that move, a lot of people have targets from themselves.
Yeah,
Like, let
yeah.
me work 30
Mm.
years or 25 years, then I
And then
go
I
back
can go
home.
back. Mm-hmm.
Yeah. So thank you, thank you, thank you.
Mm-hmm. Thank you so
So
much.
thank you. We'll stop here.
Okay.
And very soon I'm going to bring another person. But
Mm-hmm.
Martha, I really
Mm.
appreciate you. Don't
Thank you for
forget to
having
like
me.
my audience. Don't forget to like, subscribe, share with friends, colleagues, aspiring nurses, and don't forget to hit that notification button to notify you whenever we have a new video. Thank you, Martha.
Thank you
See
so
you.
much for having me. Have a good
Bye.
one. Bye.